10 supervised consumption sites are slated to be closed across the province in March, 5 in the city of Toronto. Last week, an open letter was sent to the Ministry of Health, signed by dozens of organizations whose clients access these sites and the services they provide. The letter states, while we acknowledge the complexities of addressing public safety concerns surrounding the toxic drug supply, the choice to dismantle these services will have devastating consequences.
We know that when safe consumption sites close, HIV infection rates will go up. Safe consumption sites are healthcare for our community.
People will lose connection to their healthcare providers, to healthcare services. People will die. It'll put lots of pressure on our emergency services, specifically EMS, police, fire and emergency services, or ERs. This is a service that is proven. It's evidence-based. It's shown to reduce the death rates of folks.
The province is banning consumption sites from operating within 200 meters of schools or a childcare facility. It plans to replace those sites with homeless and addiction recovery treatment hubs, or HEART hubs. A spokesperson for the Minister of Health said the HEART hubs will be similar to existing models, connecting people to comprehensive treatment and preventative services, including addiction supports. Organizations that signed the letter disagree.
The HEART hubs are actually really important. They're supportive housing, and we desperately need housing for folks. However, they're not treatment sites. They're not going to allow any distribution of harm reduction materials or supplies, and it's not a replacement for the services that are provided at supervised consumption sites.
The letter urges the government to reconsider its decision to prohibit supervised consumption sites and harm reduction equipment.
These sites are not just a place where people come and they accomplish a task. They are really healthcare hubs. So when they exist in the community and people can access them, their overall health improves and our communities become healthier. And from a public health standpoint, from a human rights standpoint, even from an economic standpoint, it very strongly tells us that these sites should remain open and these services should remain available in Ontario.
The Ministry of Health and its partners will fund the creation of 10 hubs across the province, with an additional 9 to be added later. The hub should be providing services by the winter of 2025. In Toronto, Beverly Andrews, CityNews.